Hello and welcome. Today we'll be diving into a significant cardiovascular concern that often flies under the radar: renal artery stenosis. This condition, involving the narrowing of arteries supplying the kidneys, can have far-reaching consequences for your overall health. Join us as we explore its causes, effects, diagnosis, and management. So, what causes renal artery stenosis? In the majority of cases, it's a result of atherosclerosis, a process where plaque, composed of cholesterol, fat, and other substances, builds up inside the arteries. This is essentially the same process that can lead to heart attacks and strokes. Another less common cause is fibromuscular dysplasia, or FMD, is a condition where the cells in the artery walls abnormally grow and thicken, causing narrowing. FMD is more common in women and can affect other arteries in the body besides the renal arteries. Rarely, other conditions like vasculitis, or inflammation of the blood vessels, can also lead to renal artery stenosis. Now, let's understand what happens in the body when these arteries narrow. Think of your kidneys as the body's filtration system. They need a consistent blood supply to function properly. When one or both renal arteries become stenotic, or narrowed, the kidneys receive less blood. In response, the affected kidney releases hormones, most importantly renin, which raises blood pressure, contributing to hypertension, often resistant to multiple medications. Over time, the reduced blood flow and increased blood pressure can damage the kidneys themselves, potentially leading to chronic kidney disease and potentially even kidney failure. The heart is also affected as it works harder to pump blood against this increased resistance, ultimately increasing the risk of heart failure and other cardiovascular events. Renal artery stenosis is more common than many people realize, though precise numbers are difficult to pin down because it often goes undiagnosed. It's estimated to affect a few percent of the general population, but the prevalence is much higher in individuals with pre-existing conditions like high blood pressure, heart disease, peripheral artery disease, and diabetes. As the population ages, and these risk factors become more prevalent, the occurrence of renal artery stenosis also increases. The symptoms of renal artery stenosis can be subtle, and often there are no symptoms at all, especially in the early stages. High blood pressure that is difficult to control, especially if it develops suddenly or worsens significantly, is a primary clue. Other possible signs include a bruit, which is an abnormal sound heard through a stethoscope placed over the renal arteries in the abdomen, an unexplained decline in kidney function. Some people might also experience fluid retention, leading to swelling in the legs and ankles, as the kidneys struggle to regulate fluid balance. Diagnosing renal artery stenosis involves a combination of physical examination, medical history review, and imaging tests. Your doctor might start by listening for a bruit. Blood and urine tests help assess kidney function and look for indicators of kidney damage. Imaging techniques play a crucial role. Doppler ultrasound can assess blood flow in the renal arteries. CT angiography, or CTA, and magnetic resonance angiography, or MRA, provide detailed images of the arteries, revealing any narrowing. Renal arteriography, an invasive procedure where a catheter is inserted into an artery and dye is injected, is the gold standard for diagnosis, but it's typically reserved for when intervention is planned. While the term types isn't strictly applied to renal artery stenosis in the same way as, say, with cancer, it is helpful to classify the condition based on the underlying cause. We primarily differentiate between atherosclerotic renal artery stenosis, caused by plaque buildup, and fibromuscular dysplasia-related stenosis. These two etiologies often require different treatment strategies due to their distinct underlying mechanisms. Treatment for renal artery stenosis aims to control blood pressure, improve kidney function, and prevent further cardiovascular complications. Medical management involves medications to lower blood pressure, often using ACE inhibitors or ARBs, medications to control cholesterol, and antiplatelet agents to reduce the risk of blood clots. In some cases, a procedure called renal angioplasty and stenting may be recommended. This involves using a balloon catheter to widen the narrowed artery and placing a stent, a small mesh tube, to keep it open. Surgery, such as renal artery bypass, is rarely needed but may be considered in complex cases. Unfortunately, preventing renal artery stenosis can be challenging, especially when the underlying cause is fibromuscular dysplasia, which isn't always preventable. However, for atherosclerosis-related cases, adopting a heart-healthy lifestyle is paramount. This includes eating a balanced diet low in saturated and trans fats, cholesterol, and sodium, exercising regularly, maintaining a healthy weight, quitting smoking, and managing underlying conditions like diabetes and high cholesterol. Regular check-ups with your doctor can help detect and manage risk factors early. The prognosis for renal artery stenosis depends on several factors, including the severity of the narrowing, the underlying cause, the presence of other medical conditions, and the response to treatment. Early diagnosis and effective management can significantly improve outcomes and prevent progressive kidney damage. Untreated renal artery stenosis can lead to significant complications, including end-stage renal disease requiring dialysis or kidney transplantation. Research continues to explore new and improved ways to diagnose and treat this condition. Current research efforts are exploring drug-eluting stents for the renal arteries to prevent restenosis after angioplasty. Further research is also needed to better understand the pathophysiology of fibromuscular dysplasia and to develop more targeted therapies for this condition.